So there's different things that are going on right now. The last 10 phone calls, the last 10 people that have called in have asked me about this Social Security health care bill, all this stuff that they're trying to do right now. They're trying to get rid of Social Security, privatize it, or just, I guess Paul Gosar, which may or may not be true because I haven't had him on the air yet, has said that people should work until they die.
Yes, I was in that meeting when he said that.
So he did say it.
Absolutely. but let me frame that up. That was a comment about himself. I don't know that he said that to apply it to everybody universally, but that was certainly a comment that he was going to work until he died.
So he's going to work until the day he dies. No retirement, no relaxing with the kids, no going fishing. He can do that in between the schedule that he sets for himself.
Well, that's certainly the perspective, yes.
And, I think that there was a couple guys like Milton Berle, I think they pretty well, but they were comedians. Everything was a joke to them, I mean, that's a little bit different. Well, the health care bill that's coming effective, I guess, isn't it? January 1st? I mean, is that...
You're already starting to see changes occur. You'll see it in rate increases. You'll see doctors starting to pull out of specific plans. You'll see insurance companies starting to restrict where they do business. So
that's already beginning.
Oh, yes. Yeah. Absolutely. Yeah, the healthcare industry is preparing for all of the things that are coming, and they're not waiting until everything is enacted to become law. I mean, it's been signed, it's working its way through the system, but this is not going to happen overnight. Companies have to change their processes, they have to change systems, they have to train personnel on how to adhere to new practices. They need to understand what those practices are. So this isn't going to all of a sudden happen overnight. It takes real time to take care of it.
Well, how do you feel about the bill, personally? I mean, do you support it? Are you dead set against it? How do you feel about it?
I'm dead set against it.
And tell me why.
There's a couple of reasons. One is I believe that health care decisions reside first and foremost with the individual.
And not with the government.
Not with the government. And after that, it rolls up to the family members and perhaps into the community where it affects those that are closest to those individuals. In extreme situations, it may need to go to state where you have laws that we've all agreed to as citizens of that state, but it should never, ever go to a federal level, to a federal body, to a federal governmental agency.
Is it Orwellian in nature? Is it, I know it's a big brother kind of a thing, there's no doubt about it, just because of the concept of we know how to take care of you because you can't take care of yourself, clearly, because you've been messing up for all these decades. Do you get that kind of vibe from it? That it's...
You do, and that violates what I believe is unique and precious about America, is our individual freedoms.
Yeah.
We have the right to pursue liberty and happiness and careers and other things the way that we want to. And it's okay to fail. It's okay to fall down and bloody your nose and skin your knees and get up and go again, or to lay there for a little bit and just kind of lick your wounds.
Yeah.
But eventually we
get up.
Yeah. Keep going.
That's right. Get up.
But you learn by failing.
Yes.
There are great lessons in failure, and whether that's on a personal level or whether that's in corporations, there's great value that comes to us as a society by failing.
Well, Eon, let me ask you this. If you, or when you are elected as senator representing the state of Arizona, can that be overruled, repealed, overturned? Where are we now as far as our rights as individuals to choose, like you say, what type of health care plan or no health care plan or whatever we want? Is there a way to calm it down, tone it down, or do something else with it and not have it as overpowering as it is to so many American citizens?
Yes, but it's not going to be easy to do because once something is signed into law, especially when you have a majority of a ruling body like the Congress that has voted it in, it's going to be difficult to move it out in its entirety. However, we can do things on a piece-by-piece basis to remove things, to limit funding, to change the rules that the bureaucrats use in order to administer the law. You have to work at it constantly in order to strip it down and to minimize its impact. And when there's an opportunity to repeal or to cast it aside completely, then you jump on that opportunity.
Uh-huh.
You have to hold to those correct principles and constantly work towards them.
Yeah.
But it's not going to go easy or quickly.
Well, but now they're saying, we thought that Social Security was carved in stone, and now there's all kinds of different little backroom plays going on to try to reinvent Social Security.
Correct.
So is that the same thing? Like these tax breaks that Bush had put in, a decade ago, however long it was, they're getting ready to expire. This health care bill, does it have an expiration date on it? Can we put it back in the back corner and get it to sour quicker, or is it one of those things that...
Well, we may be able to play with some of the dates in terms of implementation as to when things become effective. That would be one way to delay some of its impact.
And if there's different people in the Senate, different people in the Congress at the turn of the calendar year, then that's possible to do
correct.
that?
Yes.
So you could actually slow down the impact of the...
Yes. You have to remember that all of the detail within the bill takes time to implement.
Yeah. Oh, yeah, I know. It's
and if you can stop those along the way to minimize impact, then that's at least something we can do immediately. The other thing to keep in mind is that states are going to fight this from a position of states' powers.
Yeah.
So some of this is going to be fought over in the courtroom for many, many years.
And that's going to put that on hold anyway.
Yes, it will.
Yeah. Well, there's some tax trailers on the end of it.
There are.
I can't read the whole thing because I just get a headache every time I start. But I saw all these trailer bills that were approved with that, and a lot of them are tax bills, are excess tax bills, are extra taxes.
They are. It's a backloaded bill. All of the costs for us as people show up earlier than all of the benefits later on. So when you look at the overall structure, it's an ugly bill.
Yeah. Man, I can't believe it.